Hello everyone, I am Dr. Neha Tyagi. I am a dermatologist and I am based in Jodhpur, Rajasthan. Today I will be talking about a very common skin disorder, atopic dermatitis. In simple language, it is also known as eczema, and the patient usually has very dry skin. There can be patches of dry, rough, scaly skin, and the symptoms are usually itching. It might be associated with burning sensation, and eventually, because of constant itching and constant rubbing, the patient can develop lichenification of the skin. That means the skin can become thick and dark colored at the site of involvement. Now, a very common question which comes to our mind is the cause. The cause of atopic dermatitis is still not very clear, though there is a genetic predisposition. That means if a patient has a family history of atopic dermatitis, then there are more chances of him suffering from the disease. There is a family history of atopic dermatitis in most of the individuals who are suffering from this. This can be in the form of asthma, some food allergies, though they are very rare. Then there can be allergic rhinitis, there can be some difficulty in breathing, very dry skin, or there can be a history of frequent cough, frequent cold. The patient might get sick with change of weather, and the skin is usually dry as compared to a normal individual. They need extra emulsion, extra moisturization for their skin than a normal individual. Next very important thing is the role of epidermis. So in very simple language, epidermis is the outermost layer of our skin. So it acts as a barrier to various pollutants, various irritants or various microbes. So it protects our skin from insults from outside, and at the same time it also helps in retention of water. So in individuals who are suffering from atopic dermatitis, this epidermis is not that strong, so they are prone to infections. At the same time, water retention property is not very effective, so they tend to lose more water from their skin, and this is the reason for a more dry skin as compared to a healthy individual, as compared to a normal individual who is not suffering from atopic dermatitis. Now the symptoms. See, the sites of involvement, they are different. They are different in a child and they are different in an adult. In a child, mostly the extensors are involved. By extensors, we mean the front part of our arms, of our legs. Cheeks are most commonly involved. The cheeks are red, they are scaly, they are very dry. But if we talk about adults, then in adults there is a flexural predominance, which means their neck is involved, then the front part of their elbows, back of their knees. So these areas are more commonly involved in an adult. So the sites of involvement are different in a child and in an adult. Along with these skin patches, there are some other signs, or we can say there are some other features which are present. So these are, there is darkening beneath the eyes. Eyes are darker. The surrounding skin of the eyes is dark as compared to the normal skin of the face. Then there can be an extra fold of skin below the eyes. Then the palmar creases, they are increased, and at the same time these patients, they have small follicular bumps, we can say, which is known as keratosis pilaris in medical language. These are spiny papules which are more commonly seen over the thighs, over arms, and sometimes over the face. So these are some additional features which might be present in these individuals, and they help us to make a diagnosis. Now, how to make a diagnosis, how to suspect? There is not a definitive test to confirm the diagnosis, but yes, in most of these patients, their serum IgE levels are elevated. But a proper clinical examination, a thorough examination, then a family history, a detailed family history, then history of frequent cough, frequent cold, seasonal variations, some kind of rhinitis. So all these things, a detailed history and a detailed physical examination usually helps in confirming a diagnosis. Now comes the treatment part. So as I said, it is not a curable disease. It cannot be cured. It can be kept under control with medications and with certain lifestyle modifications. So in case you think you are suffering from atopic dermatitis and you are not getting better with such modifications, so you need to see a dermatologist. In brief, I'll be telling some of these modifications which can be done to get a relatively disease-free period. These are like, you should not keep your skin dry. Always use a very mild soap for bathing. Immediately after bathing, when your skin is still damp, that means when your skin is still wet, apply a good moisturizer in generous amount. It should be a thick moisturizer and it should be applied immediately after bathing on a wet skin, and you should reapply it whenever you feel your skin is getting drier. Do not let your skin to become dry, because this is the most important part in case of atopic dermatitis. Your skin should not be dry. So always use a mild soap and a good moisturizer in good amount, applied immediately after bathing. Then always look for some aggravating factors. For example, I'll name a few. Some people, they experience an aggravation of their symptoms with change of weather, or if there is a sudden change in temperature. Then some have aggravation with cigarette smoke, with dust, with anxiety, or when they are under stress. So these are some aggravating factors. So if you are suffering from atopic dermatitis, if you think you have it, then you should look for some aggravating factors. Try and avoid these factors. There is no cure for the disease, but yes, with certain medicines and certain lifestyle changes, we can keep it under control, and yes, we can experience a relatively longer disease-free period. And if you think you are not getting relieved with such modifications and you need some treatment or you need some advice, then you should consult your dermatologist. Thank you.